Welcome. My name is Sindhu Ravishankar. I'm the Vice President of Programs and Research at the International Association of Providers of AIDS Care and the Fast Track Cities Institute. This module is titled COVID, HIV, and Me, and it's about the social determinants of health and intersectional issues that make communities more susceptible to COVID-19. Upon successful completion of this activity, learners will be able to identify social determinants of health, define how the conditions and environments in which people live, work, play, worship, and age can affect health outcomes, and understand how social determinants of health and intersectional issues make communities more susceptible to COVID-19. Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Social determinants of health also contribute to wide health disparities and inequities. For example, people who do not have access to grocery stores with healthy foods are less likely to have good nutrition. That raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who do have access to healthy foods. Social determinants of health are a primary driver of health inequalities. In this webinar, we will explore the key determinants and intersectional issues that make communities more susceptible to COVID-19 and poor health outcomes. Starting in the early 2000s, the World Health Organization facilitated the academic and political work on social determinants in a way that provided a deep understanding of health disparities in a global perspective. In 2008, the WHO Commission on Social Determinants of Health published a report entitled Closing the Gap in a Generation, which aimed to understand from a social justice perspective how health inequity could be remedied and what actions could combat factors that exacerbated injustices. The 2010 Affordable Care Act in the United States embodied the ideas put in place by the WHO by bridging the gap between community-based health and healthcare as a medical treatment, meaning that a larger consideration of social determinants of health was engaging in the policy. In the preamble to the Constitution of the World Health Organization, it defines health as, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Other important points raised are, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. The health of all people is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. The achievement of any state in the promotion and protection of health is of value to all. Unequal development in different countries in the promotion of health and control of diseases, especially communicable diseases, is a common danger. Health is quite variable, not just among individuals, but also across different population groups. Here's an example. In 2015, the life expectancy of a child born in Sierra Leone was 50 years, whereas in Australia it was 83 years. That's a difference of 33 years. But there are differences even within countries. For example, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. Within a population, health is also influenced by social status. People with a higher level of income, higher levels of education, and a better occupation have better health outcomes and a greater life expectancy. Health status can also change. For example, studies of migrant and displaced populations have shown that the type of diseases, health behaviors, and risk factors are different in migrant and displaced persons compared to those in their country of origin. So why is there so much variability? To answer that, we need to look at the things that influence health. A person's health is influenced by a range of factors. These are called determinants of health. These include who the person is, individual factors such as age, gender, and genetic makeup. It also includes their health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, live, learn, work, play, worship, and age. These include social and community networks, socioeconomic status, cultural and environmental conditions that people live in, and also health systems. These are collectively called the social determinants of health. The social determinants of health are ultimately shaped by the distribution of money, power, and resources at the international, national, and local levels. They have a marked influence on health inequities, which are the unfair and avoidable health differences between different groups of people within countries or between countries. There are many different social determinants of health working at many levels and with complex interactions between them. This social determinant includes things like income, cost of living, socioeconomic status, employment, food security, and housing stability. In the United States, 1 in 10 people live in poverty, and many people cannot afford things like healthy foods, healthcare, and housing. People with steady employment are less likely to live in poverty and more likely to be healthy, but many people have trouble finding and keeping a job. People with disabilities, injuries, or conditions like arthritis may be especially limited in their ability to work. In addition, many people with steady work still do not earn enough to afford the things they need to stay healthy. Economic instability in the context of COVID-19 may also look like working in a job that requires interaction with the public and being exposed to COVID-19 at a greater amount than someone who may work from home. People with higher levels of education are more likely to be healthier and live longer. Children from lower income families, children with disabilities, and children who routinely experience forms of social discrimination, like racism or bullying, are more likely to struggle with math and reading. They're also less likely to graduate from high school or go to college. This means they are less likely to get a safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. In addition, some children live in places with poorly performing schools, and many families cannot afford to send their children to college. The stress of living in poverty can also affect children's brain development, making it harder for them to do well in school. Interventions to help children and adolescents do well in school and help families pay for college can have long-term health benefits. In the context of COVID-19, poor education access and quality can affect literacy level, making understanding health information difficult to understand. The neighborhoods people live in have a major impact on their health and well-being. Many people in the United States live in neighborhoods with higher rates of violence, unsafe air or water, other health and safety risks as well. Racial and ethnic minorities and people with low incomes are more likely to live in places with these risks. In addition, some people are exposed to things at work that can harm their health, like secondhand smoke or loud noises. Additionally, neighborhoods perceived as low income or with higher rates of violence are often seen as places where companies do not want to invest, leading to food deserts and fewer employment opportunities. Interventions and policy changes at the local, state, and federal level are needed to reduce these health and safety risks and promote health. In the context of COVID-19, this could mean people may need to use public transportation to get groceries or prescriptions, leading to greater exposure of COVID-19. People's relationships and interactions with family, friends, coworkers, and community members can have a major impact on our health and well-being. This determinant also includes things like cohesion with the community, civic participation, discrimination, and conditions in the workplace. Many people face challenges and dangers they cannot control, like unsafe neighborhoods, discrimination, or trouble affording the things they need. This can have a negative impact on health and safety throughout one's life. Positive relationships at home, at work, and in the community can help reduce these negative impacts. But some people, like children whose parents are incarcerated or adolescents who are bullied, may not get support from loved ones or others. Interventions to help people to get the social and community support they need are critical for improving health and well-being. In the context of COVID-19, communities without adequate social and community support may have low levels of health literacy or may not prioritize communicating about health issues. Many people in the United States do not get the healthcare services they need. The connection between people's access to and understanding of health services and their own health are key to addressing this inequity. This determinant includes key issues such as access to healthcare insurance, and health literacy. About 1 in 10 people in the United States do not have health insurance. People without insurance are less likely to access healthcare services. They may not be able to afford the healthcare and the medications they need. Strategies to increase insurance coverage rates are needed for making sure people get important healthcare services like preventative care and treatment for chronic illnesses. Sometimes people don't get recommended healthcare services because they live too far away from healthcare providers who offer them. Interventions to increase access to healthcare professionals and improve communication, in person or remotely, are needed to help more people get the care that they need. Community health centers with providers who come from the community and community-led health initiatives may help with persistent medical mistrust that come from historical mistreatment of racial and ethnic minorities in the science and medical field. In the context of COVID-19, lack of access to quality healthcare and medical mistrust have led to higher rates of COVID-19 positivity, lack of vaccine uptake, and more severe outcomes from COVID-19 infection. In November of 2021, the American Medical Association released a public statement that announced the recognition of racism as a public health threat and committed to actively working to dismantle racist policies and practices that affect healthcare. This is vital to addressing the health effects of structural and systemic racism and class inequality that are often rendered invisible due to either lack of attention or narrow perspectives that study these factors in isolation. Racial minorities represent alarming rates of incarceration, discrimination, harassment, and assault in police and justice systems. Incarceration can lead to higher risk of contracting COVID-19. An early study of the pandemic found that U.S. counties with higher Black populations had higher comorbidities, higher proportions of uninsured people, as well as higher proportions of unemployed people, higher exposures to air pollution, and more COVID-19 diagnoses and deaths. A similar study of Latino majority U.S. counties found consistently higher COVID-19 incidence despite no significant differences in underlying health conditions or social distancing scores compared to other counties. Socioeconomic inequalities have disproportionately affected marginalized populations such as racial and ethnic minorities, sexual minorities, and persons with disabilities, exacerbating health disparities. Members of these groups are more likely to struggle with mental health and or social economic insecurity issues that have been shown to restrict access to care and housing. Both race and low socioeconomic status are closely linked to the likelihood of being overrepresented in work deemed necessary to maintain critical infrastructure associated with transportation, healthcare, and the supply of food and energy. These workplaces have been central sites of infection and transmission of COVID-19. Intersecting with race, the COVID-19 pandemic has also had a strong impact on immigrant communities. Immigrants generally have less access to quality healthcare and are disproportionately represented in jobs that cannot be done at home. This has meant an increased exposure to the virus. The COVID-19 pandemic has exacerbated the consequences of policies such as the public charge rule that bars immigrants from participating in safety net programs such as Medicaid and Supplemental Nutrition Assistance Program. While Native and foreign-born minorities face different obstacles to healthcare, the combined trio of exposure risk, lack of access to testing, and pre-existing conditions such as high blood pressure, diabetes, and cardiovascular disease make COVID-19 particularly life-threatening. Transgender communities, particularly Black transgender women, have higher rates of job loss and insecurity and experiences discrimination. Many rely on sex work for income and risk contracting COVID-19. Queer and trans communities, particularly older adults, queer youth, and folks of color, experience higher levels of social isolation. Lack of access to social networks may increase risk of contracting COVID-19 and being unable to meet needs for daily living. Queer and transgender communities, particularly those who are people of color, face alarming rates of incarceration, discrimination, harassment, and assault in police and justice systems. Social and gender minorities who are incarcerated or recently released may be vulnerable at this time. They face risk of contracting COVID-19 without consistent means to prevent, spread, or access health care. Key people or communities that are more susceptible to COVID-19 may be racial, ethnic minorities, immigrants, and those with poor healthcare access. Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Other intersectional issues such as race, socioeconomic status, immigration status, and discrimination make communities more susceptible to COVID-19.